So this overall increase in activity really is being fueled by two different things, and it's really a cumulative impact of these two different things. So we have number one, that many provincial public health measures or public health restrictions were lifted, including capacity limits, mandates regarding indoor masking. But we also have the subvariant of Omicron being labeled BA2, which has some further mutations than the Omicron variant, which means that it's actually more transmissible, so spreads easier than the Omicron variant. And this variant, or BA2, is becoming the dominant variant in Ontario. We have not had as significant number of confirmed cases here across HKPR, but as we see it become the dominant variant in other jurisdictions, it's just a matter of time for it to be the dominant variant. And given that it spreads easier than the Omicron variant, we expect that to continue to fuel ongoing COVID-19 transmission across the region. So while we certainly all, I think, hoped that the fifth wave would be our last big wave, or at least we'd have a bit of a longer period of time to catch our breath. I think it is fair to say that we are entering another wave, or we have entered another wave. What we want to call this wave, I think, really doesn't matter, whether it's the 5.5 wave, whether it's the 6th wave, but we are seeing a surge equivalent to a wave. And the question now really is, how large will this wave be? If I had a crystal ball, I'd be able to tell you for sure. But at the same time, there are also things that we can be doing right now to try and diminish that wave, or at least blunt its impact on our healthcare system. When we think about what tools we have available, so certainly the big difference between how we are approaching this wave and previous waves is that we don't have the provincial mandates in place. However, we do have several other tools that we know work well to help prevent COVID-19 transmission, and more importantly, to prevent severe illness associated with COVID-19. None of these things are surprises. It's all familiar things: vaccination, staying home when sick, masking, avoiding or limiting social gatherings, and then your other basic routine measures like hand washing, covering cough, this sort of thing. So to speak a bit more about vaccination, so without a doubt, vaccination continues to be one of the most important tools that we have available to prevent severe illness from COVID-19. Of the 29 deaths that have been confirmed across HKPR region since January 1st of this year, almost 50% of those were among individuals that were unvaccinated at all for COVID-19. We know that the vaccines do work very well against preventing severe illness, and there's very good data locally, provincially, nationally, and globally to demonstrate this. If we look at our coverage, we do have good coverage. There's always room for improvement among individuals that are age 70 and over. So certainly the population that's at higher risk of severe illness, 86% have received their booster dose for COVID-19. However, that still means that or to give you a sense of the number of individuals still eligible for their booster dose, among those age 60 and over, there's almost 12,400 people across HKPR that could get their booster dose now, that are eligible for their booster dose, but for different reasons haven't received that booster dose yet. We also know that there's also a large population that hasn't received any doses of vaccine. And at this point in time, while we continue to talk about booster doses, there's still certainly time and there's still certainly benefit to receiving your first dose and then completing your series of COVID-19 vaccines. So COVID-19 vaccination, still an incredibly important tool, and I encourage everyone that hasn't yet received their vaccine to do so.